Hi, my name is Evelyn Cabrera. I'm a respiratory therapist student at Miami-Dade College, and I'm here to explain and demonstrate the use of a breathing device called insensitive spirometry. But first, you need to review your chart for significant data. Significant data includes indications for the use of this insensitive spirometry. Indications include patients that are more prone to develop atelectasis. But before I go on, I would like to explain to you what atelectasis is and which type of patients are more prone to develop this. We have two types of atelectasis. One is reabsorption and the other one is passive atelectasis. Reabsorption occurs when mucus plugs are present in the airway, and passive atelectasis happens with the persistent use of small tidal volumes by patients. This type of patients that have gone general anesthesia, heavy sedation, abdominal surgical surgery are more prone to develop this type of atelectasis. For this reason, we will use this breathing device to mimic the natural sigh by fully expand their lungs by taking deep breaths. Now that I explained to you the indications of this breathing device, I'm going to tell you the contraindications. So since this breathing device is so simple, we have very few contraindications. Now that I check in my chart and I review my chart for the indications of the breathing device called insensitive spirometry, I am going to go in, introduce myself, identify my patient, wash my hands, and put on gloves. Hi Krista, my name is Evelyn. I'm here as a respiratory therapist student, and I'm going to show you how to use this breathing device called insensitive spirometry. I see you're going to an abdominal surgery, but first, before I go on, I'm going to wash my hands, and I'm going to demonstrate to you how to use this, okay, for your recovery. Since I'm not going to be washing my hands, I'm going to use this antiseptic bio hand cleaner. They usually tell you at the bottom how many seconds you need to scrub your hands with. Make sure you remove all your jewelry before you do that. You rub your hands until it's completely dry. Do not use paper towels for this. Then you will put on your gloves. After you put on your gloves, you identify your patient. I checked that my patient is Krista Wilson and her date of birth with the same chart. Before you go on explaining to your patient what insensitive spirometry is, you need to make sure that you do a baseline preliminary planning, a baseline assessment. This includes a target volume set, a goal set, a target volume for your patient, pre-vital signs, and pre-breath sounds. Inhale and exhale, please. You do the complete breath sounds, and you take the heart rate and respiratory rate. Thank you, Krista. Now, Krista, since you're going to go to a surgery, before you go to a surgery, this breathing device called insensitive spirometry is going to help you from developing lung complications like atelectasis, and it's going to help you by deep breathing, okay? Mm-hmm. So this is the patient's tubing, this is the mouthpiece, and I'm going to assemble the equipment for my patients. The way you set a target volume for your patient is by the age and height. My patient is 25 years old and 63 inches, so you will set the goal for 2,500 milliliters. You try to have achievable goals set for your patients. Now, Krista, after you finish with your surgery, I need you to use this device. This is the way you will use this device. You would exhale normally. You would take a deep breath, take a breath hold for 5 to 10 seconds, then exhale normally. Do you think you could do that to me now?
Yes.
Thank you. Great job. Now, this is called an inspiratory coach. This yellow indicator I need you to, while you're inhaling, I need you to keep it in the happy face. You see there's two unhappy faces? While you're inhaling, I need you to keep it in the happy face. Okay? Will you be able to try that now?
Yes.
Thank you. Perfect. Now, remember, Krista, while you're inhaling and keep it in the happy face, when you can inhale no more, take a breath hold for 5 to 10 seconds, then exhale normally. Don't exceed yourself. Let's try that again. Perfect. Good job. Now, this is going to be done 5 to 10 times per waking hour. And if you want, between each maneuver, you could wait 30 seconds to a minute. Since you're going to do a surgery, sometimes it's going to hurt you to cough because I need you to cough after you've done doing this treatment. What I'm going to explain to my patient is a procedure called splinting. This is putting a pillow to your patient's surgery area and have them hug the pillow for them to cough. This is called splinting, and it's going to help my patient from feeling pain towards coughing while they're coughing. Krista, when you're finishing your procedures, you need to cough. So you will press your pillow on your abdominal area and try to cough. This is going to prevent from you feeling pain. Will you try for me? Great job. After I'm done making sure that my patient has demonstrated to me that she could use insensitive spirometry and that she could follow instructions, I need to make sure that this breathing device it's reachable for my patient. I want to make sure that it's in reach for her. You could put it on the side bed, or you could put it on the table. I'm going to be leaving it for her here. Since she's going to leave a surgery, I want to make sure she has it very close to her. Before you leave, you need to do post-vital signs, and post-breath sounds. You complete your cycle for breath sounds, and you take your heart rate and respiratory rate. Make sure your patient is safe and comfort. Krista, do you feel safe and comfort?
Yes.
Perfect. Make sure that you motivate your patient and reinforce your patient for using this breathing device to prevent lung complications like atelectasis. Krista, do you understand why is this important for you to use insensitive spirometry after your surgery?
Yes. To help my lungs.
Perfect. You think you could do this 6 to 10 times per waking hour?
Yes.
Thank you, Krista. Now, since I'm done making sure she understands and she demonstrated back to me how to use insensitive spirometry, I will take off my gloves, wash my hands, but in this time I'm going to use my hand satinizer gel again, make sure it's dry and sharp. Now, before I finish, I will make a note. Demonstration and motivation is the most important thing for your patient to understand why it's important for her to use insensitive spirometry. So motivate her for her efforts. Thank you. Now that I am done explaining to you insensitive spirometry, my partner Krista Wilson would explain Easy PAP, and I will be her patient.
Hi, my name is Krista. I'm a respiratory care student from Miami-Dade College, and I'm here to show you the Easy PAP, also known as positive airway pressure. The indications for the Easy PAP are to help prevent or to treat atelectasis. It's very important that your patient is able to follow instructions to use this procedure. The contraindications for this procedure is if your patient's intracranial pressure is greater than 20 millimeters of mercury, or they have just recently had oral, facial, or skull surgery, or even trauma. If your patient is also feeling any kind of nausea. The hazards of this procedure are if you use any kind of pressure that's higher than is recommended, it can cause intracranial pressure, it can cause your patient to more likely to swallow the air and to vomit or aspirate. Now that you know the indications, the contraindications, and the hazards, I would like to show you the Easy PAP. This is the Easy PAP. This is the mouthpiece that the patient will be placing their mouth around. This is the ambient. Never occlude the ambient because your patient will not be able to breathe. You also need the tubing. This will connect to the flow meter to the Easy PAP. This is your manometer. This measures the pressure by centimeters of water. Now that I've demonstrated you the equipment, I would like to show you what you would do to this procedure. You would get your chart, you would go through your chart to see what procedure you are performing on what patient, and you knock on your door. Hi, my name is Krista. I'm a respiratory therapist for you today. I'm here to give you the Easy PAP treatment. But first, let me wash my hands. I will not be using soap and water, I'll be using a hand sanitizer. As my partner said before, you look on the back of the bottle to see what the recommended amount of time is to wash. This one is recommended for 30 seconds. Make sure all jewelry is removed. Go through between your fingers, under your nails, around your cuticles, all up to your wrists. And then you don your gloves. Before I proceed with this procedure, I need to verify my patient. I look at her wristband, I check her name and her date of birth, and I compare it to the chart. If it matches, this is my correct patient. Then I'm going to do my pre-vital signs and breath sounds. You can sit up for me. Breathe in whenever time you feel my stethoscope. I'm going to check her pulse for 60 seconds, followed by her respiratory rate for another 60 seconds. I'm going to make note of these because I will be using it for charting later. Now, I'm going to gather my equipment and place it together. Manometer goes on top. Oxygen tubing. I'm going to connect it to the flow meter. Make sure your flow meter does not exceed 50 to 60 psi. You want to start it off at 5 liters per minute. I'm going to instruct my patient to take a deep breath, not all the way, and then you're going to exhale slowly. Normally you would have a nose clip during this procedure if your patient cannot control her breathing strictly through the tube through her mouth. So once I place this in your mouth, make sure your lips perform a nice seal. Inhale and exhale slowly. While she's doing this, I'm watching the manometer pressure. Her goal is to get it between 10 to 20. I can adjust the flow if she is able to tolerate it. Now I'd like you to demonstrate 10 to 20 breaths for me. Okay. After that, I would ask my patient to demonstrate 2 to 3 huff coughs. If your patient is able to cough anything up, you make note of the color, the amount, the thickness, and if there's any odor. You do this procedure 4 to 8 times within the next 10 to 20 minutes. After this is done, you can turn off the flow, place the equipment to the side, and do your post breath sounds and vital signs. Take a deep breath. You do your full breath sounds. Check her pulse for 60 seconds, followed by her respiratory rate for another 60 seconds. Ask your patient if they are comfortable, if there's anything else you need. Are you comfortable? Is there anything else I can get for you? Remove your gloves. Wash your hands for 15 seconds, or the hand sanitizer for 30. You leave your room, and you would chart. You would chart your pre, your post vital signs, if there was any sputum, and what the procedure was, which was the Easy PAP. Thank you.
Thank you.